Hello, everybody. So, in my previous video, I explained the science and the physiology of cholesterol, what it is, and what it does in the body. In this video, I'm going to review all of the trials on statins, and I'm also going to explain the side effects of statins. So, um, in my previous video, I explained how important cholesterol is in the body. In fact, from all the research I've done, I believe that we still don't know a lot about the role of cholesterol in the body because it is present in every single cell in the body. And I believe that there's so many functions to it that we haven't even discovered yet. So, another thing is that an important antioxidant called CoQ10 is produced from cholesterol, okay, in the liver. So that explains why statins cause muscle cramps. Most of the people who take statins actually develop muscle cramps. And why does that happen is a question that I started to ask myself. Um, this is because the antioxidant called CoQ10 or ubiquinone it's called, it is made from cholesterol and it is needed by every single cell in the body to produce energy in the mitochondria. So, you know that the mitochondria is the powerhouse of the cell, which produces energy for our cells to function properly. For this to happen, it's got these beautiful membranes within which there are lots of proteins and enzymes which communicate with each other, and it's a very intricate process which requires this thing called CoQ10. Every single mitochondria in the body needs it, okay, and it's made from cholesterol, okay. So that's why statins make people feel really weak, muscle cramps and things like that. And your muscles are particularly important in order to they are particularly dependent on mitochondria for energy, right? Which is why when you look at a cell, a muscle cell under the microscope, under the influence of statin, the muscle cells literally get destroyed. They undergo apoptosis. Okay, so that is why people get muscle cramps with statins. Now, the next question I was asking myself is if statins are damaging muscles, how can that possibly be good for the heart? Because the heart is a very important muscle in the body. And I found that statins actually cause heart failure in the long term. And this study showed that people who had heart failure after stopping a statin, 79% of them became normal. Their heart failure symptoms came down. Okay. And so did the fatigue, memory loss, and nerve problems. And how many people died after 1 year? Zero. And after 3 years following up these patients, how many of them died from a heart attack or a stroke after stopping a statin? Not even one. Not even one. So, this is a study that really opened my eyes because the heart needs a lot of energy to pump throughout the day. And there is also evidence that statins increase troponin levels with exercise because if your muscles are getting destroyed, your exercise tolerance comes down as well. And this study has shown that actually troponin levels increase. But this is a sensitive test. This is not done regularly in clinical practice, which is quite convenient. Another role of CoQ10, which is an antioxidant that I mentioned, is that it actually prevents plaque formation. It prevents LDL from becoming oxidized and forming plaques. So when you take a statin, you are reducing the antioxidants present in your LDL. So that is another thing to be mindful of. So as you can see here, there's evidence that statins actually increase the number of LDL, oxidized LDL particles in your bloodstream. And it also increases something called LP little a. So I'm going to make a different video about LP little a, but LP little a, when it's increased, it means that there's more inflammation going on in the body. Now, if you look at patients who have low HDL, statins do have a small benefit. But if the patient has high HDL greater than 53, then actually statins increase risk of heart attacks, as you can see here. The reason for this I will explain with the side effects, but one is obviously it's reducing the antioxidant capacity of LDL, and also it causes diabetes as a side effect. Now let's look at every single study, okay? So there's totally 8 primary prevention studies and and 28 secondary prevention studies. So, a primary prevention study is done on someone who has never had a heart attack before, whereas a secondary prevention study is done on someone who has had a heart attack before. So, totally, we've got 36 studies. Okay. Now, let's go over how these studies are conducted. Who conducts these studies? So these studies are all conducted by a group of scientists from Oxford called CTT Collaboration. These scientists are all paid by the pharmaceutical industry, and all the data analysis, everything is done by these particular scientists who are paid by pharma. So that's something to keep in mind. Now, these prestigious scientists who conduct these amazing studies do not release this data to any independent scientists, such as myself, for example. So, this data has not been analyzed by anybody other than those people who have been paid by pharma. So, that is a major conflict of interest. Okay. And another thing that I learned while doing this research is that those who formulate the guidelines are also paid by the pharmaceutical industry. Okay. Something to keep in mind. So, with respect to statin trials, with respect to a lot of drug trials, this is something to understand, right? All of the data is collected by pharma, the entire study is done by pharma, and all the scientists are paid by pharma. Now, when pharma does a trial, there is so many things that they can do in order to skew the data and make things look better than they actually are. I've gone over this in detail in my previous videos, but this is what they do. So once they get the data, they manipulate it, they report things that they want to report. For example, if someone has a side effect or an ill outcome, those people will drop out of the study, and we never know what happened because that's not recorded in the results. That's underreporting of side effects and over exaggeration of benefits using what I like to call statistical gymnastics, mental gymnastics. For example, if there's an absolute risk reduction of 0.5%, they will use another statistic called relative risk reduction. I've gone over that in my other video, but if you want to know more, text me down below. Another thing is that a lot of the protocols funded by pharma are written by ghostwriters. So a scientist will sell their name, and someone from pharma will actually write the protocol under a prestigious scientist name so that this is accepted by a prestigious journal. And not only that, they only publish if they find that some trials show not a very good benefit, they'll publish that in a horrible journal. Whereas if they have a trial which shows good benefit, they'll publish it in a really good journal. And they have a lot of money, and most of the medical journals are also funded by pharma. So that's how it works. And this is the case even for Stanford. I've looked at Stanford scientists' work, and a lot of them are also funded by pharma. And the way that they've conducted their research is a lot of it doesn't make sense to me, to be honest, because there's so many gaps in their knowledge, and their thinking is so influenced by pharma. Anyway, The entire low fat movement, eat whole grains movement has been a massive failure and a giant experiment on humanity. It's been really profitable for the food industry because people stopped eating foods that they'd been eating for thousands of years, and now they eat, cereals and whole grain based stuff. They eat low fat, cholesterol reducing margarines. They eat processed vegetable oils. It's been a great experiment, and obesity has massively exploded, which is again profitable, obviously. Now, let's go over the trials. There's 8 primary prevention trials, okay? Let's look at how many people died in these trials and not, okay? The best trial we've got is the Jupiter trial, where the reduction of death is 0.55% over 1 year. 0. Sorry, 0.55 over 5 years and 0.29 over 1 year. That's how useful these drugs are. Okay, and as you can see here, some of these trials show increased death in the treatment group. So that's a total of 8 trials on people who've had a heart attack, who've not had a heart attack. Okay, next. So this is a statistical measure that's actually useful. It's called number needed to treat. This is very useful for me if I'm prescribing a certain drug to a patient. How many people will I have to give this drug in order to save one life? So for statins, for someone who's never had a heart attack, I have to give this drug to 313 people to avoid a stroke, and I have to give this drug to 217 people in order to avoid a heart attack. So basically, the drug is pretty much useless on a patient to patient level, and 1 in 20 people are harmed from muscle damage, and 1 in 200 develop diabetes. Now, this is where it gets even more juicy and interesting. There's 28 trials on those who've had heart attacks, okay? And around half the trials show that there's increased death in those who are treated with statins, okay? I will link this paper down below so you can look at the exact numbers. But the benefits are almost marginal, and in many of the trials, there's actually increased death in the treatment group. Okay? Now, if someone's had a heart attack, I need to give this drug to 39 people in order to prevent a further heart attack. So there is some benefit there if someone's already had a heart attack and if they've had dyslipidemia, which is low HDL, which most people who have a heart attack will have. Okay? But if you see, 1 in 50 still develop diabetes. Okay? So still, I don't think this is such a big benefit. Diabetes is, of course, really profitable because I think if diabetes was reversed, most of the doctors would be jobless because most of what we see is complications of metabolic issues like diabetes. Now, this is really interesting as well. I'll link all the papers down below. In 2004, there was a law in the EU in order to make trials more transparent. Okay, before 2004, all the trials, the pharma could do whatever they want. They could literally make up the data, and we would have no idea whatsoever. Now, if you divide the benefits of statin trials into pre 2004 and post 2004, you can see that the benefits of statins have completely disappeared post 2004. I will not even consider the data before 2004 to be actual science because it's not. There is no regulation whatsoever on how pharma did these trials. So, as you can see, post 2004, none of the trials have any benefits. Some of them have increased heart attacks in the treatment group as well. Now, let's see side effects. I talked about how it increases heart attacks in those with dyslipidemia, increases a type of stroke called bleeding, hemorrhagic stroke. It worsens dyslipidemia. It causes heart failure, muscle problems, muscle cramps, pain, falls, especially in older patients. It lowers immunity, I've talked about the role of LDL in immunity. So it increases risk of cancer and infections. It increases your risk of osteoporosis long term because vitamin D is made from cholesterol. Cataract. Another concerning side effect is mental health issues, depression, psychiatric issues, dementia, memory issues, and memory problem is actually listed as a side effect on the BNF as well. Um, and diabetes, of course, diabetes literally damages every cell in the body. So these are the side effects, and there's really no convincing evidence, in my opinion, that there is that much of a benefit. And I just want to add my clinical experience as well. So many patients who've had their statins removed, I've seen them in clinic, and they would have had a hospital admission and they had some liver problem and got taken off. And they're able to walk again. After many years, they're able to walk properly. So, what is the benefit if we are significantly ruining people's quality of life by giving them this drug? I've seen so many patients who have told me that they were unable to walk because of the statin, and they even tell me that family members who have been prescribed a statin would immediately start using a walking stick the next day. This is not an acceptable side effect, in my opinion, as a clinician. And even the person who discovered statins refused to take statins for his own cholesterol. And he said that the indigo dye wears white trousers, which means in English, he sells the toxic substance knowing that it's toxic but doesn't use it on himself. And that's why I would like to end this video. The next video, I'm going to talk about what actually causes heart disease, what are the risk factors, and what you can do about it, and medications and drugs that actually might help. Thank you.